Hi viewers, please do watch, share, subscribe to my channel. I am going to discuss about the key clinical features which are distinguishing acute from chronic mesenteric infarction. There are another 3 parts of videos of mesenteric infarction. Please do watch, share, subscribe to my channel. This is the 4th part of video of the mesenteric infarction. The key clinical features distinguishing acute from chronic mesenteric infarction or mesenteric ischemia are acute mesenteric infarction. In acute mesenteric infarction, there is sudden onset of severe abdominal pain that is disproportionate to physical examination findings. Pain is typically intense, diffuse in acute mesenteric infarction, constant, and may be accompanied by nausea, vomiting, and diarrhea. In acute mesenteric infarction, we see signs of peritonitis or sepsis, which may develop as infarction progresses. There are some urgent symptoms which do occur in acute mesenteric infarction, such as an urgent need to pass stool and urine can occur. Usually, acute mesenteric infarction is related to an abrupt blockade of the blood flow due to an embolism or thrombosis. In acute mesenteric infarction, there is a rapid progression to bowel necrosis if untreated, making it a medical emergency. So, what are the things that we have to remember in acute mesenteric infarction? Sudden onset of severe abdominal pain. Pain is intense, diffuse, constant, often accompanied by nausea, vomiting, and diarrhea. There may be signs of peritonitis or sepsis. Urgent symptoms may be there like passing stool or urine, and sometimes fever can occur. Usually, acute mesenteric infarction is related to an abrupt blockade of the blood flow due to embolism or thrombosis. There is rapid progression to bowel necrosis if untreated, making it a medical emergency. Next, chronic mesenteric infarction. Presents with postprandial abdominal pain that typically starts about 30 minutes after eating. Pain gradually worsens over an hour and usually resolves within 1 to 3 hours. Chronic mesenteric infarction is associated with food fear, fear of eating due to pain, and significant weight loss from malnutrition. Because the patients do not eat due to pain, they have a significant weight loss from malnutrition. In chronic mesenteric infarction, symptoms develop insidiously, often due to gradually worsening arterial narrowing or atherosclerosis. Chronic mesenteric infarction generally lacks the dramatic sudden severe pain seen in acute ischemia. So, what are the things that we have to remember in chronic mesenteric infarction? It presents with postprandial abdominal pain, which starts about 30 minutes after eating. Pain gradually worsens over an hour and resolves within 1 to 3 hours. Pain is associated with food fear, fear of eating due to pain, which in turn leads to significant weight loss from malnutrition. Symptoms develop insidiously, often due to gradual worsening of arterial narrowing, that is atherosclerosis. Chronic mesenteric infarction generally lacks the dramatic sudden severe pain seen in acute ischemia. In summary, acute mesenteric infarction presents with sudden severe and disproportionate abdominal pain with systemic signs, whereas chronic mesenteric infarction presents with recurrent, predictable post-meal pain and gradual weight loss reflecting chronic ischemia. Medical students, what do you read about? What are the differences between acute mesenteric infarction and chronic mesenteric infarction in terms of pain? What is the symptom difference between acute mesenteric infarction and chronic mesenteric infarction? In which acute or chronic mesenteric infarction there will be signs of peritonitis or sepsis, and in which part of the mesenteric infarction, whether it is acute or chronic, they are severe. What is bowel necrosis and why does it occur in acute mesenteric infarction? Why does symptoms develop insidiously, and what is the reason in chronic mesenteric infarction? What is food fear in chronic mesenteric infarction? Read all these. Thank you. Please do watch, share, subscribe to my channel. Thank you.